much, Vern. Well, welcome everyone. I know for some of you it's an early morning. For others of you, it may be a different time of the day. But I'm glad you're here to join us. Let me just share my screen, get my slides up here. And one thing I just would encourage you, if you have a clarifying question, don't be afraid to put that in the chat. You can interrupt if you need something clarified. Uh, I hopefully can handle that just fine. So I am going to talk a little bit about inhalants today. And so I thought, what we're going to try to do is understand what inhalants are, how they're used, what some of the effects are, some of the physical signs and behavioral signs that you might be able to use in screening. And I'm also going to talk a little bit about prevention because that's what I do. So first of all, just a definition of what do I mean when I'm talking about inhalant abuse. And I think it's worth just spending a second here to make sure that we're clear about that. So what I'm talking about is intentionally concentrating and breathing in gases and vapors with a goal of intoxication. And interestingly, inhalant abuse is often considered the silent epidemic. It doesn't get as much press as some of the other substances of abuse or other epidemics that we're facing, but it's been around for quite a long time, this problem. These are some quite old examples from the United States that where, we were trying to help young people understand that doing this, for example, correction fluid whiteout is commonly used, as well as markers was something that they identified as being used. But the problem is still around, and statistics are pretty hard to come by. Many deaths are not recorded as due to inhalant abuse, but they actually may be. Um, Sometimes it's just logged as respiratory failure, asphyxia. We also have something called sudden sniffing death, which I'll talk about, that causes arrhythmias, fatal arrhythmias, and then a whole bunch of deaths that are attributed to reckless behavior that are a result of their use of inhalants. So car accidents, fires, explosions, those kinds of things. So some things to remember about inhalant abuse at the first time use can often be deadly. And there's a quite old now, but Great Britain study that showed that 40% of the deaths that were due to inhalant abuse showed no signs of previous use. Now, that's not saying that 40% of first-time users will die. We're saying of the people who died, about 40% of them it was their first time. So we know that from surveys in the United States that we are consistently documenting up to 26% of 12-year-olds have experimented with inhalant abuse. What the good news is that lots of them don't continue with the behavior. About 4% seem to continue with that behavior. So what are the different types of inhalants? That's one of the messages I think that you should walk away with from my talk today is that there's lots of different types of substances that are used in this way that can be inhalants. So the first category are volatile solvents. So correction fluids, dry cleaning fluids, glues, nail polish remover, paint thinners, and petroleum products. So anything that when you have the liquid sitting there can emit vapors, they can concentrate those and inhale those. We also have aerosols. So, what people are seeking from aerosols usually are the propellants, not not the paint itself, but the carrying agent. So these can be things like deodorants or hairsprays, fabric protectors, spray paints, vegetable oil sprays. Pam is a brand in the United States. I'm going to attempt to get a little participation from my audience. For aerosols and in particular paints, does anyone know what the preferred color of spray paint is and why that might be true. Wonder if anyone can use that good old chat box. Anybody have any idea? Just see if people are actually awake out there. There are two colors of spray paint that are preferred as by folks who are huffing. One is gold. Anybody guess what the other type is? It's another metallic color, silver. So gold and silver spray paints are preferred because the paint itself, having the heavy metals in it, actually requires more propellant. So folks will buy those color paints if they're looking to access the propellants in the canister. There's also gases, so bottle gas, propane, cigarette lighter fluid, which is butane, medical anesthetics, or they'll use nitrous oxide from whipped cream. We've actually been seeing in the United States that NOS canisters, which are used in drag racing, young people seem to be getting a hold of those and having, pop-up street parties where they are utilizing the nitrous oxide from those canisters to get highs. So one other category of inhalants is nitrites. And I mentioned this, it's not always considered under the umbrella of inhalant use due to some differences, but the primary use is for sexual enhancement if folks are doing that. So it's not necessarily to get high per se, but they're trying to enhance their sexual experience. So, but it is a category of things that are intentionally inhaled. So I just wanted to make a comment about that. So there are two different groups of people that we want to look at as to who's most likely to use. And they're very different. Young people, and in fact, kids start in the US anyway as young as third grade. The highest rates of inhalant use among youth are white youth. No big difference in girls versus boys, primarily in rural areas. And the folks seem to have a higher incidence of personality disorders or emotional problems, often come from homes where there's parental drug or alcohol use. When we look at the adults who use, they're much more likely to be white males or American Indian or Alaskan Native or a multi-ethnic origin. They tend to never have been married. They have attended college. They tend to be higher income and more likely concentrated in metropolitan areas. So two very different profiles of the young user and the adult user. I think it'd be very interesting to get some more information about how that is, if that distinction is true in other countries. And it's not something that's immediately clear from what I've seen out there. So how do people ever get started with using inhalants? How do they learn about using it? Why would they consider doing that? Lots of times it's word of mouth. They see it in the media or sometimes accidentally when using a product and they notice that it made them, feel a little different. Often they see the products or see use in their workplace. For adults, workplace use is pretty common. One of the reasons is because I'll talk in a minute about the fact that the onset of the high is pretty rapid and it also dissipates very rapidly. So if you're at your desk, don't want to get caught by your boss, then doing a quick huff sometimes can seem less risky than taking something that's going to have a longer effect. Often users are looking for sexual enhancement or they just don't have anything else to use in order to get that high. So some terms you may hear folks using, sniffing, that's pretty straightforward. Sniffing, smelling directly from the container. I was just sharing before we logged on that with Indigenous youth in Canada, we were seeing that young people who are riding snow machines would actually take the cap off the gas tank and sniff directly from that. So that's pretty much the most straightforward way to use. Huffing, when we say huffing, you usually concentrate some of the product on cloth or rag and put it in a bag so that they can capture more of those fumes. Bagging is specifically spraying something in a bag and inhaling it from the bag. Pretty common with paint products. Glading, if you're using an air freshener, because Glade is a common uh, name of a product here, trade name of a product in the US. And then dusting. Computer gas duster used to be commonly not compressed air. Most in the United States now are mandated to be compressed air rather than having some of the other compounds in them. So the compressed air canisters do not give people that effect. So they're looking for the ones with other chemical agents in them. So I'm going to go into a little bit about how, because that may help you look for signs of use. So usually people inhale deeply, take several more breaths, may spray the aerosols right in their mouth or nose. They might put the chemical on their collars and sniff, I mean, on their cuffs and sniff this way, on their collars and sniff it that way. Soda cans is pretty popular, or they may use balloons for things like nitrous oxide. Reportedly, most of these products have a quick onset high, and it usually doesn't last for more than 1 to 5 minutes, or 15 minutes or less. It initiates in 1 to 5 minutes and doesn't last much more than 15 minutes. Wide range of sensations because it depends on what it is they're using, and as well as their physical factors and emotional factors. But they experience initial excitation, drowsiness, lightheadedness, agitation, hallucinations or delusions, and loss of inhibitions. So many people will say they feel like they're floating or spinning or have numbness, hallucinations, as I said, sense of indestructibility, insulated from the woes of everyday life, being in control or dominant, and they report that it helps block unpleasant memories and thoughts. Unfortunately, these have many effects on the body. So they have central nervous system depressant effects, many of the compounds, much like alcohol. They move through stages of intoxication like they do with alcohol. But the high really depends on what chemicals they use, the dose, the intensity of the exposure, the size of the user's expectations and emotional state, and even the setting where they're using can really make a difference on how they experience the effect. So many people will report that the high is more euphoric or intense than something they could get from alcohol, and very rapid onset. They can go from one emotional state to an altered state within just seconds. This gives more of an instant gratification for many users. And because it dissipates so quickly, they'll often binge by dosing again and again and again. So why would people use inhalants? For young people, we've found that they believe that adults don't know anything about inhalants. So they believe they can, use this and not be discovered. Most of the products are legal. So there's not that added worry of having something that's illegal. Most of them are fairly cheap. You can access them in hardware stores or even grocery stores. Many youth believe that using inhalants is legal because the products are legal. In many places in the United States now, we have laws that say that if you do purposely uh, inhale products, that is illegal. It's interesting to try to enforce, but those laws are there. And many just really don't understand the dangers of abuse because these are everyday products and they don't believe that they can be harmful. So you don't need a complex set of paraphernalia. You don't need syringes. You don't need, a bowl or a bong or anything to smoke it with. You can use almost anywhere. You can conceal the products fairly easily. And there's a wide range of products that users can choose from. Don't need to deal with a dealer. And often household products, the adults, if it's young people using adults or even in an office setting, we're not necessarily monitoring the levels of products and noticing that they're disappearing faster than they should. A common thing in the restaurant industry is when they have whipped cream in a walk-in cooler, for example, and they have a store of whipped cream, that the restaurant managers will often notice that all the whipped cream is flat. It no longer has any propellant in it. And that's because employees are going into the walk-in cooler and utilizing that for a quick boost. So things that you can watch for. If people have multiple household products without a reasonable need for those, that can be a red flag. If there are lots of baggies or rags or empty aerosols under the bed, in the closet, in law enforcement often find at the scene of a car accident, they'll see aerosol cans or bags or rags that are paint stained on the floors. Um, Whip topping or other aerosols are always low on the propellant. Or because these products often have strong smells, they'll use a lot of perfume or body sprays or breath mints to try to mask the odor of the chemicals from other people. So other things that you can watch for, if they're using paint, they will have paint on their hands, around their nose, lips, fingers, face, painting their fingers with correction fluid. So you could see when I was teaching high school, I would see students that had whiteout painted on their fingernails that put on several really thick coats, and you can scratch it a little bit to reveal the wet substance underneath, and they could sit right in class and do that. They'll often smell clothing, markers, rags, that they may have butane lighters that are empty or partially filled, or refill cans, even if they don't smoke. And if they are non-compressed air keyboard cleaners, you might see lots of those around. So again, things to look for: paint or stains on bodies or clothing. They'll have actual skin irritation around their nose or their mouth. They'll have red, runny eyes due to the irritants and the chemicals. They may smell of chemicals on their breath. They may have very dazed appearance, nauseous, lack of appetite, or very irritable, excitable, anxious, facial rashes and blisters. Those are all signs that they've been getting these chemicals on their skin. Uncontrolled laughter, anger, agitation, constant sniffing or coughing because they've irritated their airways. Many of these chemicals cause dilated pupils or mood swings as well. For paraphernalia, you may see rags, paper or plastic bags, scarves or bandanas, again, because they can put things on that and then bring it up to their nose and mouth. Cotton balls or swabs are another way to things that they can soak with chemicals. Cloth baby diapers are pretty popular. Soda cans, so they will spray the aerosol into the can, and then they can put their nose up to the hole in the can. Clothing often will have long sleeves or big collars. So gold and silver paint, deodorants, hair products, cooking sprays, whipped cream, fabric protectors, those are aerosols in particular that you will see. And then for volatile liquids, gasoline, correction fluid, glues, acetone, um, felt tip felt tip markers. Many manufacturers are now making safer markers that don't have the same chemicals as a carrying agent for the pigments. Dry cleaning agents are very potent, a little more difficult for folks to get, but when they can access those, they're quite popular. And often dry cleaning stores have to experience burglaries for that. So gases, really scary, but Freon. Some of you may be aware that Freon is a heavy gas, will displace oxygen in the lungs. So it's super dangerous, but it is something that folks use. Medical anesthetics, if they can access those, butane lighters, laughing gas, NOS, which is in whippets, or gas grills. propane. One of the things that can happen, unfortunately, is that people will put their mouth directly on the nozzle of like a propane tank and turn it on, and the pressure is so high in the canister can actually rupture their lungs. Helium, people often ask me, when people inhale a balloon full of helium, um, is that something that they're doing to get high? They say people are just trying to sound funny, but we really should discourage kids from doing that. Um, it's not an inhalant, but it's an asphyxiant. In that, again, that air pressure in the tank. And if the helium is not medical grade, who knows what's in the tank? And it can really introduce some harmful things into their airways and lungs. So, what do these chemicals do? They affect a variety of organs, including the brain, and lead to sensory and psychological disorders. What we think is that many of these chemicals dissolve the myelin sheath that's around neurons and around the brain cells, and it results in cell death. So, in the cerebral cortex, we get cellular death that causes permanent personality changes. You can get memory impairment, hallucinations, learning disabilities when young people use them. In the cerebellum, damage there, you can have lack of coordination. For heavy use, especially with paints, this is very common to see lack of coordination, tremors, things like that. And then sight disorders, because that nerve for sight is very susceptible to damage by many of these compounds. This is an old image, but it shows brain damage. So healthy brain is on the left and a toluene user on the right. And you can see that the brain areas have shrunken. We've got many studies that can show that uh, regular use of these compounds definitely result in physical changes in the brain. So some of the other effects in the blood, they can inhibit the oxygen carrying capacity. I need to have a little sip of coffee. Wake my tongue up. Um, so it can, interfere not just because of damage to the lungs, but also can impair the um, ability of the blood cells to carry oxygen. In the lungs, you can imagine that inhaling cooking spray or fabric protector or spray paint can coat the lungs, cause lung damage. And the liver takes a lot of abuse from halogenated compounds. So we see direct damage to the liver from some of these compounds. Kidneys, um, kidney function is affected, and often that's reversible, but not always. And it seems to increase kidney stones, muscle wasting disease, reduce muscle tone, strength. And in the bone marrow, we've actually seen that benzene can cause leukemia. So folks who are long-term um, users of gasoline fumes will develop leukemia. Special note about something called sudden sniffing death syndrome. And this is important if you're around folks who have been using. And extremely important to know that many of the types of inhalants can cause this. But if you interrupt someone while they're actually in the act of using an inhalant, the startle reflex when you interrupt them, or if somebody were to come in and yell at them, that jump in adrenaline can actually initiate a fatal arrhythmia. So it's not, I mean, it's a real thing. We've seen folks that just collapse, and it's due to an arrhythmia, and that startle reflex can actually trigger that. So it's important to know about this, especially if you interrupt someone, that it's not a good idea actually to yell at them to stop or to chase someone, something like that, because they can actually collapse from that. Um, other dangers in terms of using inhalants, we get agitation and violence, which leads to assaults or accidents. Lots of these things are flammable. Lots of fires become started, so they can have explosions or burns. asphyxiation. If you inhale a heavy gas and don't and still remain upright, it displaces oxygen, and so they'll asphyxiate. Um, People put bags over their head, which again, we know is not a very good idea, but they will do that in order to get all of the vapors. Sometimes they will have a small plastic bag and inhale so vigorously they'll actually inhale it and it will plug their airway. And then some people are allergic to some of the chemicals in the products and can have a reaction that can lead to death. So, can we test for these things? Well, some things we can, but many tests are unreliable and depend on so many physiological factors. Most of them are fat soluble or in the other tissues and not necessarily in the blood. False negatives are common. For many products that are commonly abused, the body actually breaks them down pretty quickly. And which thing do you test for? There are so many different chemicals that it's hard to know exactly what to test for, and testing is extremely expensive. So, in terms of testing someone that comes in for inhalant abuse or monitoring that they're being abstinent, it's a tough one. Unless you're really sure what they're using and have access to good testing, it's a little bit of a challenge. So the better option, which I will say because I do work in the field of prevention primarily, is, what can we do to prevent this? So when we talk about young children, we need to make sure that that we're aware of our language and that language matters. So we need to make sure that when we're dealing with common household products, that we're teaching young children that they're safe to use for their intended use, but they're not meant to be put in a body, that they're actually poisonous or toxic. So make sure that you help young children understand what toxins can do to the body. Many young people are sensitive to environmental impact, and sometimes just letting them know about the effects on the environment can actually dissuade them from using these products. And make sure that you model safe practice. So make sure that you model reading the label, model using products that are volatile in well ventilated areas, and only using things as they're intended. We can also emphasize oxygen's importance to the body and to life. We need to teach them how to seek out an adult if they see someone using inhalants, and use the vocabulary of safety. So use terms like toxin, poison, chemical fumes, body pollution, things like that. When kids get a little older, again, that environmental um, perspective can be a motivating factor for them to not use. Talk about personal safety, negative effects of oxygen deprivation. You can talk to them about these other gases replacing oxygen in the body. And you can tell them a little bit more about the short-term and long-term effects of inhalant abuse. You can even get into the effects on fatty brain tissue. You can talk about policies, about the law. Um, don't teach them how to do this. I wouldn't tell a youth audience about about silver or gold being the best paint in terms of the amount of propellants. Um, Again, we need to continue teaching, reading labels, safety precautions, following the directions, awareness of physical symptoms. So, sounds pretty straightforward and yet not. It's actually very tricky for youth because we need to let them know about the dangers, but we need to avoid actually showing them how to use it. So don't show young people the products or the paraphernalia. Don't show them how-to videos. Don't offer the names or types of products. Best uh, practice is to try to determine how much they already know. If it's a little, you can keep your teaching is fairly simple. If they know a lot, you may have to be a lot more honest and get into the specific toxic effects of products if they already know that. So be honest with young people, but let them kind of set the stage. Talk about body effects. Make sure you let them know that damage can be permanent. Go over how the body operates, that what the central nervous system does, how important your brain and nerves and blood and oxygen are. And then, you can explain or show them what neurological damage looks like, stroke or a head injury. That can be what the outcome is for use of some of these products. And that may actually be a little bit less attractive to them if they can see that you could have the effects that look like you had a stroke or you might actually have a stroke. Make sure that you teach about sudden sniffing death and fight or flight response. Um, Also, you can include information about talc uh, containing products. And so it can accumulate in the lungs. Stress that the products are not meant to be put in the body. So specific dangers that you can teach about is suffocation and explaining how that some of these products can displace oxygen or they can coat the lungs so that oxygen can't get through the blood barrier in the lungs. Make sure that they are, you know, aware that inhaling a balloon or a plastic bag or something, this can cause choking, fire dangers. And, the fact that many of these products create mood changes, including violent mood swings, and that they might, harm themselves or harm someone else. And then there's always falls or, because of that lack of coordination or car accidents, things of that nature. So for any age, you know, we want to stress that you don't really know when you might have a toxic experience, either a dosage or the conditions are just wrong for you. You can die from your first time using, you could die from your 10th, never, but do you really want to gamble on that? The products are this behavior is clearly dangerous. So, what do you do if you come upon someone who has used? Um, if they're unconscious, make sure you put them in the recovery position, lay them on their left side, make sure that you protect them from aspiration. You may need to start CPR if they've been the victim of an arrhythmia and they don't have a pulse. Make sure you call 911. Ventilate the room because you may end up, if there's fumes in the area, you don't want to become a victim yourself. Never run or yell at someone that you suspect may be huffing because of that adrenaline rush can cause the arrhythmias. So try as much as you can to approach calmly, keep them quiet, turn them on their side, call 911. So I pulled together some resources here, things that places where you can look for more information. These are US sources. But they have some good information. I would love to hear any questions or any comments. You've all been very quiet. I hope some of you are at least still awake. I gave you a lot of just kind of dry information, but what questions do you have about this or experience to share in terms of coming in contact with this? Anyone?
Um, Dalene, there's a question in the chat box. Let me just read it to you. So they are saying, thank you for the wonderful presentation. How would you treat those who sniff a particular substance in light bulb and others who dig dead cups and have some part of their bones powder just to sniff? So they have become addicted to it so that some even sleep in the crematorium while others go out in search of light bulbs.
Yeah, and how you approach this really depends on the motivation. From what I understand from practices of inhaling bone, that's usually not for a high. It's more of a spiritual belief that they have. So I would explore what's motivating them to do that, because that's going to be where you will start in terms of treatment or reframing. In terms of, the gases that are in light bulbs, again, just explaining the dangers of inhaling those chemicals. That's certainly not meant, designed to be put in the body. Addiction is difficult, right? People do get addicted to having these chemicals. And we need to treat them like we would many other substances of abuse, right? In terms of therapy and all that. But you may also, depending on what products they're using, you may need to explore what the physical effects on the body are, so that you may need to support their bodies as they go through any type of withdrawal. But behavioral therapy is certainly one of our first lines of defense, although pretty difficult. Often adults especially, who are using these products have a long history of struggling with some challenges and, as we say, leaning on these. But behavior, first defining the motivation, because the approach would be very different if they're seeking this out because of a spiritual belief than it would be for a physical addiction. And then, thinking very specifically about the chemical use and how you might address why they're seeking out this, but also to explore more what the physical experiences they are getting from this, and how to assist them with finding other ways to deal with what's driving them to do that.
So thank you for that. So you also mentioned about how like very few research are done in this area. Well, in fact, when you mentioned the possibility of fatality, it's very high. So what could you suggest, like for researchers, for our academicians, like any tips on how to like pay attention, I would say, maybe to this specific substance?
Well, I mean, it happens. It is prevalent. And one of the things that we know is educating first responders about what to look for in terms of paraphernalia can be very helpful, because often, many traffic fatalities are because people were huffing while they were driving. And if you don't know that empty canister on the floorboard is something that should warn you, or even if a police officer pulls over someone who's operating erratically, they're not going to find opioids or alcohol or anything in the car, but they may not know to look for the paraphernalia of inhalant abuse. So educating about some of the paraphernalia, talking to people who are seeing this on the streets and becoming more educated about what some of the products of choice are, working to explore what kinds of either policy changes or physical barriers can help. Educating restaurants about the fact that whipped cream containers are, something that many of their young employees, or even the older employees may be coming up against, so that you can educate for what to look for, how to monitor levels of products that are commonly abused, consider exploring some policy changes to make access to some of the products, a little more difficult for young people, at least, or, having restaurants more closely monitor supplies of whippets or things like that. So it's really helping people recognize it is the first step. And then, I think this is not something that's going to go away. It's been with us for a long time. And I would love to see more researchers really looking at, are there differences in patterns of use? what is driving, because access to other substances of abuse is one thing, but also the rapid onset and rapid disappearance of symptoms is another driving factor for adult use, especially in the workplace. So what do we know about that? How could we actually get a handle on that? Because the image that I suspect many people have is of people that are living on the streets or don't have access to other things. And that's not actually accurate. I mean, there are some folks, yes, that would fit that kind of stereotype, but we know that there's lots of well-educated folks who are doing this in the workplace, and very young people who are doing it, as experimentation. And that group may be, not actually understanding the dangers as much.
So
That
thank
was
you.
helpful, Fern.
Yes, you have actually put some two points. Like first is that we have probably even as clinicians, we have preconceived notions on who are the particular group that uses inhalants. And then second is like how deceptive inhalants use can be, because these are everyday products that we actually have a lot of access to and we don't consider it dangerous. So recognizing like as you have mentioned, like the number of canisters that have been used as a symptom for inhalant use. So are
Interestingly, in the United States, we saw an uptick in inhalant use among young people at the start of the pandemic. And what might you imagine could be driving that?
like restrictions.
Right, restriction and access, right? I mean, they're in the home for long periods of time. And so, that's what they're turning to. And parents often don't know what to look for. So,
And I think it's kind of hard like to test, right? You have mentioned that because we don't have the mechanism to test all of these different substances and their effects don't last long. So it's kind of hard um, for us to recognize without the presence of paraphernalia or other substances if they are using. But are there any like recommendations that you give in terms for, so we talked about researchers, we talked about first responders. How about like in terms of clinicians? Like is this something that how can they ask or like sort of integrate this into their screening or assessment processes?
well, I would just ask about it specifically. Consider it as one of the ways that people may be turning, for relief, if you will, or for pleasure, whatever. I think that, screening for depression, anxiety, sensation seeking, all those things, that continues, but asking directly, not only we often ask, do you drink a lot, drink frequently? And we ask, are you using prescription pain meds inappropriately? But how many times have you been asked, have you ever used inhalants? Or, it's not asked. And I think it's something that we should consider asking, kind of as a matter of fact. The prevalence won't be as high, but there are pockets of folks who use these and they're extremely dangerous. So identifying them and making sure that you can get them into intervention is pretty important. Long-term effects from heavy use are pretty obvious. I mean, it's central nervous system effects are, like I said, those of us that have been around, and probably you could recognize someone who sniffs paint on a pretty regular basis because they have a very classic disorganized gait and, agitated. Yeah, it's long-term use is something we want to try to avoid. So asking directly about it.
So thank you for that. Are there any more questions from our audience? If you have good internet connection, feel free to unmute yourselves. You can also use the chat box for any of your questions.
Yeah, I would love to hear what you're seeing or not seeing, or what you're curious about, or what other resources you might need in order to integrate this into your practice. Like what might be helpful for you to learn more about, or to have resources for where you can go. I must be scary, Verna.
Hi. Anyone who wants to share? Jane, I saw you unmute yourself. Would you like to speak?
Thank you very much. My name is Jane Gure from Kenya. I'd want just to mention, you've brought to our attention the inhalants. I think our concentration has been on these other substances, and rarely do we think of inhalants. We do studies. If you look at the assist tool as we collect data using it, yes, we concentrate more on these other substances, but there are those who admit they have used inhalants such as glue, paint, and thinners, but we don't make good use of that information. We over-concentrate on the cannabis, we concentrate on alcohol, and now the upcoming shisha. But at high levels, we've seen inhalants being used, but we don't raise our voice around inhalants. So we are grateful for this information, and we will make good use of it. Thank you.
Thank you, Jane. Saw Fred come on camera for a moment there. I don't know.
So anyone else who wants to share your experience in terms of inhalants? So for us in the Philippines, we see students using markers. Like because before initially we used the traditional chalk box, right? And then but then when it became markers and whiteboard, and then you see that the amount of markers that are lost are like it's like um not commensurate to the amount of how often the teachers use it. So that's one of the things. We do have some people that well, we have a population that sniff rugby, and then some that actually does like similar to what South Africa has mentioned with regards to not airplane fuel. We probably don't have money for that, or we don't have the resources for that, but mostly like normal gas and diesel in stations. Yeah.
Gasoline is more used than diesel. Actually has more volatile compounds in it than diesel fuel does. But yeah. So I hope you'll take some of this information, get curious, ask a little bit more when you're out on the street. And my contact information is in the slides that were put in the chat box. So if I can assist with any other questions, I'd be happy to try to point you in the direction of some other additional resources.
Okay, thank you. Any last questions before we go? Okay, so Dalene, thank you so much for sharing your expertise with us. We were very happy to have you with us, and to our audience, thank you for being here. So if you want to know more about ICU DDR's upcoming webinar, please follow us on our Facebook page or go to our website www.icuddr.com. And without further ado, thank you everyone, and we hope to see you in our next events.
Thank you for having me.
Thank you.
Thank you, Dalene.
Thank you. Yeah, thank you.
Be well, everyone.